Hey guys, it's Hina here at Rebalance Physical Therapy and Wellness in Center City, Philadelphia, as well as on the main line in Narberth, Pennsylvania. And I am a pelvic floor and orthopedic physical therapist that specializes in treating the spine, hip, pelvic, and pelvic region, as well as our clinic located here. And today, I want to talk to any of you who might have been diagnosed, and actually when I say any of you, meaning you women, who have been diagnosed potentially with something called vulvodynia, or perhaps you stumbled upon the word vulvodynia on all of your other Google searches, or perhaps in one of my other videos. So vulvodynia is basically any type of symptom that involves pain, swelling, burning, irritation, achiness, pain that is located in the vulvar region. And what I mean by the vulvar region, I'm going to show you a picture for those of you. So if you look at the female anatomy over here, the vulvar area is basically any of this right in through here, basically this pink area. Any pain, achiness, symptoms, itchiness, irritation, burning that you're having that involves this area is generally called vulvodynia. And it's kind of an umbrella term because it can involve many different things. But oftentimes what we see here in the physical therapy world is that the muscles in this area can actually get involved. The muscles of the pelvic floor can get involved in this area, and we'll talk about that in a bit. So with vulvodynia, basically, I already kind of talked about the symptoms of like pain and irritation and achiness and itching and burning and all this kind of stuff that can be involved. Sometimes there's no, what is the cause basically of vulvodynia? Sometimes it can be a hormonal change. Sometimes there can be trauma, perhaps from birth, if you've had a tear down there, or perhaps you've had some type of surgery that provoked this. Sometimes chronic yeast infections or urinary tract infections or any type of an infectious process that is happening in this area can trigger this off. And then other things that can cause this is actually the muscles down in an area called your pelvic floor. Now, for those of you that don't know what the pelvic floor is, I have another video that actually explains what the pelvic floor is. So perhaps click on that. It'll give you an idea of what it is, but we'll talk about it briefly here as well. So now, these are not the only things that can cause vulvodynia. Sometimes it just comes on sporadically and there's no reason why. People have no idea why it started. It may just start off as, hey, I'm noticing discomfort when I'm sitting, and then that discomfort gets worse and worse. Or perhaps intercourse becomes uncomfortable all of a sudden, or using a tampon becomes uncomfortable. And you're noticing, hey, this is kind of strange and this is weird. And perhaps it followed by an event. Perhaps it was after you had your child. Perhaps it was after a sexual encounter that was not comfortable for you. So there could be many, many different reasons why this comes on, but those are just some of the main reasons why vulvodynia can occur. So today I'm going to be talking more about the musculoskeletal side of why this can happen, even though there might be a hormone imbalance or a urinary tract infection or something trauma related or hormone related or perhaps infection related that maybe had triggered this off. So regardless of what triggered vulvodynia off, many, many, many times what can happen, okay, is even if you end up having a chronic infection, even if you end up having trauma, even if you had a tear, say during delivery, or this came on its own. Basically what happens is most likely the muscles of the pelvic floor at some point have also gotten involved. And most of the time, this is definitely part of the reason as far as what might be continuing to give you discomfort down there. There could be other things, but the muscles of the pelvic floor is one big area that can cause a lot of pain in this area. So what I want to do is I want to actually show you another slide here of the pelvic floor. So basically, if this area of the vulva, if you kind of open this area up, okay, and you take that, you kind of peel this layer off, what you'll find is if you look inside the pelvis, okay, because this whole area is actually inside the pelvis. If you look inside the pelvis, and you see this right over here, inside the pelvis, this is where your rectal opening would be for the female, and the urinary and the vaginal opening would be over here. This pink, reddish, everything that you see here is basically the pelvic floor. These are muscles that are inside the pelvis. So if you tilted this pelvis basically up this way, that is what you would see over here, okay? So we're kind of looking inside of the pelvis. We're looking from the top down versus from the bottom, meaning underneath this paper would be where you would basically see this right over here, okay? So you can see that these muscles, okay, surround the vaginal opening. So if these muscles become too tight, which is typically what happens in people that have vulvodynia, then anything going in or potentially coming out, okay, anything going in, if there's restriction and tightness around this opening, then it's going to be hard to have something to go into that opening. So again, with intercourse or with using tampons, perhaps using, devices or pleasure devices, basically what can happen is that's going to get uncomfortable because there's no suppleness around these muscles to allow something to enter or exit this opening. So basically what can happen is that can cause you pain. And then there's also nerves in this area. Every muscle is surrounded by nerves. That's how muscles get their function. That's how they get their sensitivity. So you can imagine if there are nerves also going through, okay, you can't see it here, but just imagine like little roots or branches kind of spreading out through this entire area. Nerves is what actually gives you pain. So if those nerves are kind of irritated in that area as well, because these muscles are so tight and not allowing proper nutrition and blood flow to get to these nerves, which is what makes nerves healthy, then you're going to have irritated nerves. And when that happens, you're going to have pain when you try to have intercourse. So the symptoms of vulvodynia, okay, along with pain, burning, and all that kind of stuff that I talked about in the beginning, functional things that people may notice is discomfort with sitting, discomfort with urination, okay, because I said, this opening right over here is also where you urinate out of. You have your urethra that comes out of there. Sometimes, and many times, what people will say is it's also pain with intercourse, and so, or pain with using a tampon, pain with sitting. Sometimes you can just have, if you're wearing clothing and the clothing rubs up against that area, that can be uncomfortable. Pain with wiping. So every time you go to the bathroom and you go to wipe, you feel like, oh, that feels irritated and uncomfortable. And so, it can be something as simple as just like touch in that area is uncomfortable. So again, oftentimes what we'll hear in our clinic is that women don't want to wear jeans anymore. They can't wear tight pants. They have to wear, dresses or skirts, and they don't want to wear underwear. Okay, that's how uncomfortable it can get. And then, like I said, anything that puts pressure in that area, such as sitting, can cause discomfort. So these are some of the functional things that most people will start talking about. And there's many other symptoms. I actually have a lot of other videos on what type of symptoms pelvic floor tightness can cause. But these are some of the symptoms and some of the common ones that we hear at our clinic. So again, those are some of the functional things. Now, what can be done about this? So basically, when we have women coming into our clinic that are complaining about this, one of the big things that we're going to look at is everything. We kind of take a holistic approach at our clinic. And what I mean by that is that oftentimes, when you go to a healthcare provider, regardless, whether it's a doctor, a nurse practitioner, whoever you might be seeing, oftentimes people can zone in on the area of where the pain is coming from. And if they don't see anything there, and oftentimes what will happen with vulvodynia is you may go and you may see your GYN and you're worried that there might be, you might have an STD, or perhaps you have an infection that nobody can find. Maybe it's a yeast infection, but no one finds that there's a yeast infection. Maybe there's a cyst, whatever it is. Perhaps you've already gone to all of your healthcare providers and they're basically saying, hey, we don't see anything there. Because oftentimes with vulvodynia, nothing actually will come up in terms of an infection or something problematic in terms of gynecology or urology. So basically what ends up happening is it's a lot of this is your musculature and the tissue in this area. And so to treat this, you actually need to look at not only the muscles, meaning these guys, which is what we evaluate, okay, as part of our exam, but just remember, these muscles are actually attached to the bones of the pelvis and into the low back, as well as into the pubic bone. So not only do you have to actually do an exam of this, but you actually have to look at the structure and the alignment of everything from your back, your pelvis, your hip, and all the muscles that kind of surround that area from the outside as well as the inside. So basically, that's what we do here at our clinic, is we look at all of these things and we say, hey, why are these muscles actually spasming inside the pelvic floor and then creating all of this pain in the vulvar area? We also would, of course, look at the other things that might be causing it, such as perhaps this could be a hormonal imbalance things, and we have ways that we test to see, could this be more of a hormonal thing? We also would make sure that there's clearance, that you don't have any UTIs or yeast infections or other types of chronic inflammatory things that may have been the cause of why this has happened. So we would be diving into that. And then, of course, then we're going to do our own exam from a musculoskeletal standpoint. Meaning we're going to be looking at all of these things and saying, why is it that these muscles are now staying spasmed? Why did they spasm in the first place? And so this is what our evaluative process basically looks at. And then usually if a lot of these muscles are tight because there's an imbalance and an alignment issue, then we have to fix the alignment. So that's where we go in. We'll work on various areas to try and improve the alignment of your pelvis. Give the muscles of the pelvic floor a better base to be able to relax. And then on top of that, work on the pelvic floor musculature. Now, there's a whole lot of other things that we also do, but for the purposes of this video, and to kind of just give you an idea of what vulvodynia is and what treatment may consist of, this is basically what we would be doing. So for those of you who, I'm sure there's many of you that are watching this video that do not live around us. And I know perhaps from my previous videos I had said, hey, yeah, give our office a call and we'll be able to help you out. But what we found is we're actually getting an overwhelming response of all of you out there who are suffering from these conditions, and we haven't been able to actually it's been actually impossible to contact everybody, but we do want to help you in some way possible. Now, if you live in and around this area, it's a no-brainer. Give our office a call. This is what we treat all the time, every day. All of us have anywhere, 15 to 21 to 22 years plus of experience each. So we do this all the time. Give our office a call. You might be able to have a free phone consult with us to be able to help you figure out if this is something that will be beneficial and who the best person to see at our clinic would be. If you are international or you are coming from out of town, we also see out of town patients, but we realize that some of you might not be able to make it to us for treatment. So in that case, we do phone consult. We do our phone consults. So, and I've helped many, many people this way to kind of help you find the right guidance, the right treatment to kind of help you get to the right place, whether it's a certain physician that you need to see, whether it's a certain physical therapist that you need to see, and perhaps I'll even be able to guide you and help you find the right people in your area to see, because these diagnoses are sometimes really, really hard to kind of figure out what's going on. So our website is www.rebalancept.com. That's REBALANCE PT.com. Some of you are already on our website, but if you're not, then you can come onto our website and then it'll kind of take you through the links to find us. And in the description below, you'll also find that information. So I hope this was helpful for any of you women who are suffering from this and you don't really understand what it's all about. And look at all of our other YouTube videos, because we have lots of other more in-depth videos that go more into what the pelvic floor is and symptoms and yada, yada, yada. Okay, so have a wonderful day. Take care.